If you are facing having a nip or a HE replacement, no doubt you're asking questions to everyone you know about the procedure, what your friends may have experienced, and if there are new options out there. Dr. Jason Rogers with Center for Sports Medicine joins us this morning to answer a few of those questions and specifically focus on their use of robotic assistance and how it helps his patients. Good to see you this morning.
Good to see you.
So I think that probably is a fair thing to say if you're facing having a knee or a hip replacement. I guess the good news is, Dr. Rogers, it's not as frightening for patients as it once used to be, and this robotic assistance, I guess, is a big reason why.
Sure. Knee and hip replacements in general are increasing across the country in terms of the volume done. We know that in the next 10 to 15 years, they're going to at least double, maybe even triple in the number that are done. So yes, with the robots that we've started adding to our repertoire, it helps us give patients the best possible outcome that we can give them.
So is this something that you're using for all of your patients, or are only certain people candidates for it?
So I particularly started using the robot a couple of years ago, and recently I started increasing that volume as I saw some of the benefits in my patients. I increased it. I'm probably doing 70 to 80% total joints via robots nowadays. The robots are very helpful in terms of making precise cuts, in terms of getting patients back to a more normal function. And standard instrumentations are very helpful also. The benefits of the robot include the fewer needs for soft tissue releases, which ultimately I've seen in my practice has been beneficial for my patients.
So is the recovery time diminished when you use the robotic assistance versus not?
There's some studies out there that are looking at that, but currently, right now, the standard instrumentation versus robotics, long-term outcomes show no difference in terms of standard versus robotics.
Until you've gone through it, you don't really understand the vocabulary. And I've talked to enough people over the years who've had it. I think I've learned enough to be dangerous, maybe. But when you talk about a total replacement versus a partial, some people think that's a worse outcome for you, but it really isn't, right? A total replacement sometimes can be almost easier than a partial.
Absolutely. Total knee replacements, depending on the patient and depending on the disease and the amount of pathology in the knee, can be very helpful. And given the newer implants that we have and with the newer technologies, we really feel that patients can get back to most of their normal activities that they were performing prior to getting the disease in the first place. So patient outcomes are very good these days. Specifically,
we had a chance to come out your way to your new surgical center there in East Brainerd not long ago. So when you're doing this robotic surgery, is that where you're doing it?
So we have 2 robots available for us at our surgery center. We're the only outpatient total joint center, outpatient surgery center that offers 2 robots that are available to our physicians. I'm doing the majority of mine there, but that's the Park Ridge Hospital also has one as well.
Okay. And everybody wants to get in before the December 31st date hits to get those deductibles met this year. Is there still the possibility of doing that? You encourage people to go ahead and come on in?
Absolutely. We have availabilities. Usually the week before New Year's, between Christmas and New Year's, that's our busiest week, but we still have plenty of availabilities if people want to have it done.
All right. Well, we thank you for your time this morning. I'm sure you have a lobby full of patients eager for you to come and see them and help them on their way to recovery. But thank you so much for your time.
You're welcome. Have a great day.
Thanks, you too. You can learn more at Center for Sports Medicine's website, which is simply sportmed.com. They have locations all across the viewing area. And if you call the number 624-2696, the folks there on Macaulay Avenue can help you with an appointment for you that is most convenient. We're back with more after this.